Hantavirus is a potentially dangerous virus that has recently gained public attention due to its severe symptoms and high fatality rate in serious cases. However, there are still many misunderstandings surrounding how the virus spreads, what symptoms it causes, and whether it could trigger a global outbreak. Here is a complete overview of what is currently known about hantavirus. How hantavirus spreads. This is one of the most important and most misunderstood aspects of the disease. The primary source of hantavirus infection is rodents, especially wild mice and rats. The virus is shed through rodent urine, feces, saliva, respiratory secretions. Once released into the environment, viral particles can attach to dust and contaminated surfaces. When people clean abandoned buildings, old storage rooms, dusty areas, or locations where rodents have been present, contaminated particles may become airborne and enter the lungs when inhaled. This is currently considered the most common route of transmission. Food or drinking water contaminated with rodent waste may also spread the virus. In rare cases, infection may occur through rodent bites or scratches. Can hantavirus spread from person to person? This remains one of the most closely watched questions. At present, most strains of hantavirus are not believed to spread efficiently between humans. However, recent studies have confirmed that the Andes strain in South America may allow limited human-to-human transmission under conditions involving prolonged and very close contact. Both WHO and CDC currently assess the overall risk of community transmission as low. Unlike COVID-19, hantavirus does not appear to spread efficiently through long-range airborne transmission. Incubation period. The incubation period refers to the time between infection and the appearance of the first symptoms. In some cases, symptoms may appear within a few days. In others, the incubation period may last several weeks, and in rare situations, up to 6 weeks. This extended incubation period can make early detection and isolation more difficult. How hantavirus is diagnosed. Currently, PCR testing remains the gold standard for diagnosing hantavirus infection, similar to the diagnostic approach used during the COVID-19 pandemic. After infection, patients typically go through an incubation phase before clinical symptoms begin to appear. Different strains of hantavirus. Multiple strains of hantavirus have been identified worldwide, and their effects on the body can vary significantly. For example, several strains found in the Americas primarily affect the respiratory system. Many strains found in Europe and Asia are more commonly associated with kidney damage and hemorrhagic complications. In recent years, respiratory forms of the disease have received increasing global attention due to their severity. Symptoms of hantavirus infection. Early symptoms often resemble the flu, which can make the disease difficult to recognize in its initial stages. The major concern is that the illness can progress rapidly into respiratory failure. Common symptoms include sudden high fever, headache, muscle pain. Some patients may also experience gastrointestinal symptoms such as abdominal pain, diarrhea, nausea. As the disease worsens, patients may develop severe shortness of breath, fluid buildup in the lungs, acute respiratory failure. This progression is considered the most life-threatening phase of the infection. Treatment options. At this time, there is no widely available vaccine specifically approved for hantavirus, and no fully targeted antiviral treatment currently exists. As a result, treatment mainly focuses on supportive care and symptom management. Supportive care. Supportive treatment may include adequate nutrition, rest, proper hydration, vitamin supplementation, monitoring of respiratory function. Symptom relief. Doctors may provide medications to reduce fever, headaches, body aches. Acetaminophen is commonly used because it can help control both fever and pain. Severe cases. If respiratory failure develops, patients may require oxygen therapy, mechanical ventilation, ECMO in extremely critical cases. ECMO, or extracorporeal membrane oxygenation, is an advanced life support system that temporarily replaces heart and lung function outside the body. Could hantavirus cause a global pandemic? According to WHO and CDC assessments, the current risk of a global hantavirus pandemic remains low. However, experts continue to monitor the virus closely due to the possibility of viral mutations and localized outbreaks, particularly in crowded or enclosed environments. Who is at higher risk? Higher risk groups include people living in rodent-infested areas, farmers, warehouse workers, construction workers, forestry workers, individuals cleaning abandoned buildings, campers, and people spending extended time outdoors. Prevention measures. Health experts currently recommend several preventive measures. Reduce exposure to rodents. Prevent rodents from entering homes, seal cracks and openings, dispose of garbage regularly. Be careful when cleaning dusty areas. When cleaning old buildings, storage spaces, or rodent-contaminated areas, wear a mask, use gloves, avoid sweeping aggressively, which can spread contaminated dust, disinfect surfaces before cleaning. Food safety. Store food in sealed containers. Avoid consuming food contaminated by rodents. Maintain clean drinking water sources. Hantavirus is a serious viral disease capable of causing rapid respiratory failure, even when early symptoms initially resemble a common flu infection. Although no specific vaccine or antiviral treatment currently exists, the virus fortunately does not spread as easily as major airborne respiratory pandemics. The most important preventive measures remain: maintaining a clean living environment, avoiding contact with rodents, wearing protective equipment in dusty or contaminated areas, monitoring symptoms carefully after possible exposure to rodent-infested environments.